Good morning, everyone, and welcome to a very special virtual job fair. This is Bob Burge with the Indiana Department of Workforce Development. Thanks for your time and joining us today. We have 5 health systems that are going to be featured, all of them with lots of employment opportunities, and we're going to get to those in just a moment. I have a couple housekeeping items, as we have, I think this is the largest turnout we've ever had. We have over 675 people registered for today's program, and that's really, really good news. And so I'm going to do a couple stall tactics because a lot of you are still logging on, we can see, and a couple housekeeping items. On your audio, if you're with somebody else, just make sure that you both have dialed in on the telephone, that both of you don't have laptops running audio because you may get some feedback. So do pay attention to that on your audio selections. Questions, if you have questions for a specific employer, be sure to do that, spell that out on who it's for. We'll try to get to as many questions as we can today. Those that we don't get to, the employers will have your contact information and can follow back up. So do send us your questions. They're over on the right-hand side. All of your lines are muted today, but on the right-hand side, you can see where you can send us questions, and we'll try to get in whatever we can. So, and today's program is being recorded. So for those of you, we're going to have lots of information to share today. And if you don't get it all, that's fine. You're going to get a copy of that recording as early as tomorrow. And so you'll have that. You'll also be able to share that with others. And so I'm going to bring up, we're going to do a couple of real quick polling questions. And as we get other people logging on, you'll see in front of you, are you currently employed? Yes or no? Just a real quick question. This helps the employers when they go back and start talking to folks. So this is just a really quick answer of whether or not you're employed. And I am going to keep it open for another 5 seconds. And really I can't believe this, but let me share the numbers. This is very interesting. So 50%, look at that, right on the exact spot. So 50% are, 50% are not, and that is very helpful. We're going to do one more quick one here, and this just is a little bit about experience. The question is, have you worked in healthcare before? Again, a very simple yes or no answer. Let us know that, and I know we have people registered throughout Indiana, and some from even out of state. So I'm going to close this out in about 5 seconds.
These are just not the only 5 positions, so these are the 5 for each.
Okay, and so there is 68% of you, so almost roughly 2/3 have worked in healthcare, and we'll be getting into these kind of jobs and what kind of requirements they have in just a moment. So thank you for your time on those polling questions. And with that, we're very excited. We're very excited to have as our host Northeast Indiana Works, which is our Region 3. And with that, I'm going to turn it over to Rick Barrett and Kim Temple to get things kind of kicked off. Thanks, you guys, for having this, and we appreciate it. Rick and Kim?
Yeah, welcome everybody. Good morning. I'm just going to talk really briefly about Northeast Indiana Works and what we do. We're the region's nonprofit workforce development organization, overseeing Work One Northeast Career Centers in 11 counties. Also oversee adult education programs and 2 youth development initiatives, one of which is Jobs for America's Graduates. Perhaps you've heard of it before, also known as JAG. We assist companies with worker recruitment and pre-assessments, help individuals chart career and land jobs, ideally high wage and demand jobs, and provide access to various kinds of training. We serve, on average, more than 20,000 individuals a year and more than 1,500 companies. In a normal year or an average year, we organize 250 hiring events. Obviously, we're in a different situation now, and in-person hiring events and job fairs are suspended for the moment. So this virtual fair is a good way for reaching out to folks. We're also involved in various regional initiatives to build talent pipelines to high wage in demand careers. Our staff has been working incredibly hard in the last month or two to carry out our mission despite the obstacles. And I should mention that in addition to myself here, we have on the program Kim Temple, who heads up our business services team, handles our human resources task, and played a really key role in helping organize this job fair. Thanks for joining us, Kim.
Thanks, Rick. Great to be here. I too want to welcome our participating healthcare providers, as well as the many job seekers who are joining us today. We hope it will be beneficial to everyone.
Thanks, Kim. Before we get started with the job fair portion of today's presentation, I want to introduce a truly special guest on hand, U.S. Representative Jim Banks. He represents Indiana's 3rd Congressional District. He's been a long-time supporter of workforce development initiatives, and he has a few remarks. Congressman? I think you need to turn up your mic.
Or unmute.
Is that better?
Yep.
Yes.
Hello?
Good.
Yep.
Okay, good morning. Great to be with all of you today. First and foremost, I want to applaud this effort. It is so important in a time like this. There's nothing that we can do that's more important to stimulate our economy than get America and Indiana back to work in the safest and most responsible way that we can. So that's why I'm glad to see efforts like these to talk to individuals who are looking for work, and especially in the healthcare field. I mean, what I learn as I serve in my current role and as I work across the country is that in Northeast Indiana, we are blessed with the very best healthcare facilities and networks throughout the entire country, from Parkview to Lutheran to now IU Health. We are very grateful for the leadership that we have in the healthcare industry. So what we're going to hear about today is our opportunities to go to work for these great organizations. And I want to applaud not just the Indiana Department of Workforce Development and Work One, but Northeast Indiana Works. What you do is so important. And my office, we stand ready and willing to do anything that we can to assist you in these important efforts. So I'll leave it at that, but thank you once again for taking time out of your day to be a part of this virtual job fair, and thanks to all of you who organized it.
Thank you, Jim. Really appreciate it. Bob?
Yeah, and again, I want to also thank the congressman. I get his regular updates, and I think we got a great leader representing that part of Indiana and really Indiana as a whole. So, Congressman, thanks for all you do. So, okay, let's get started. We're going to jump right in, and first up is Adams Health Network, and I want to introduce Anna Lee Nichols and Kevin Wellman. Thanks for joining us.
Absolutely.
Yep.
We're
You're
excited.
welcome.
Okay, great. And hey, let's start off. First question: tell us a little bit about Adams Health Network.
So Adams Health Network is located in Adams County, which is the county south of Fort Wayne, Indiana. We have 3 divisions within our health network. Adams Memorial Hospital serves as a critical access hospital in northeastern Indiana. And we have a very robust emergency, surgical, med-surg, OB unit here at the hospital, ICU. We also have 2 senior living communities, Adams Woodcrest, located in Decatur, Indiana, which is a short-term rehab, independent living, and assisted living center here in Decatur, Indiana, as well as Adams Heritage, which is located in Monroeville, just to the northeast of us, a few miles, which services a nursing center and short-term rehab. My responsibilities here at the hospital include managing the emergency department and the ambulance service, county ambulance services, which is part of the hospital. I'm sitting in today for Melissa Hess, who manages the medical surgical unit in the ICU. She was deployed last week as part of her service to the Navy Reserve. So she's serving in a hospital out on the East Coast right now. So I'm sitting in for her today and introducing her positions.
Okay, well, let's jump right in. Anna Lee, you got anything else to add, or you want to get right into the jobs?
I am the recruitment and retention specialist here for the whole network. So we will get into our jobs right now.
Okay, the first job up, I think we got 5 of them we're going to talk about. Looks like this is part of your surgical unit. Tell us what we need to know.
Okay, so this is an RN position. This is the medical surgical unit. Our medical surgical unit services those med-surg patients that you would expect to see, as well as some extended care swing bed, as commonly noted in the industry. Just to keep our census up, we have a strong swing bed unit as well as a medical surgical unit. This is an RN position, so one must be licensed in the state of Indiana as a registered nurse. And within 12 months of hire, you must have your ACLS and PAL certification, as we take care of patients ranging anywhere from the infant through the geriatric patient.
Want to talk about benefits?
I'm sorry?
You want to talk about benefits for a second?
Yeah, go ahead, Anna. You can talk
Yeah,
about benefits.
So we consider our 0.75 FTEs, meaning 30 hours per week, our full-time employees, so they'll be eligible for all benefits. We do have long-term disability, short-term disability, life insurance, and then we also do offer PTO, so that would be the first 18 days of the year. You start accruing as soon as you start.
Okay, so that's the RN medical surgical unit positions on that, and then we're going to go to phlebotomist, right?
Yep. So for phlebotomy, no certification is needed. If you do have your certification, you will get a little bit more pay. We do on-the-job training, which is awesome. We are looking for someone who is able to multitask, work well with others, and is self-motivated and enjoys working with people.
In the pay, I think we have the pay listed for that on the wages side. Okay. Next up is a RN OB.
Yeah, another nursing position in our OB unit, which is, as most of the RNs out there know, it's rare to see a position in OB unit these days. We have a very robust OB unit here at the hospital. There is always a minimum of 2 RNs on duty in our OB unit, and it's considered by the Department of Health as a baby-friendly, family-friendly OB, which for those of you who are in that industry understand that we've met certain criteria to be designated that by the Department of Health. All the RNs that are hired within our OB department will receive the NRP course, or the neonatal resuscitation course, within 6 months of their hire, as well as, of course, the CPR is a requirement for the position. The on-the-job training within the department is very, I would say, intense and thorough. Those nurses who have been in our department have been there for a long time. In fact, a couple of them delivered my children over 25 years ago. So it's a wonderful department. You rarely see an opening in our OB department, and we have one now, and we're sharing that with you.
Okay, and next up, I know as we have really the past year have been working with hospitals and health systems throughout the state, everybody needs CNAs. I guess you guys do too, right?
We sure do. So right now we actually need CNAs for our two senior living facilities. I know Kevin mentioned that at the beginning. We have one called Adams Woodcrest Senior Living, which is not even a mile away from our hospital campus here in Decatur. We also have one in Monroeville, which is just a little bit north of here, about 15-20 minutes in Allen County. We are offering sign-on bonuses for full-time employees, which is awesome, but you must have your CNA license in the state of Indiana, and we will train new hires.
Okay, so you do provide sign-on bonuses. Okay, and the last one that you want to cover is in the ICU unit, right?
Yeah, the last one is, again, an RN position in our ICU. We have a 6-bed ICU unit that oftentimes finds your patient that perhaps is a new onset AFib that might be that require a cardizem drip, and occasionally you'll have those patients that are a little bit more complicated that you might find on a ventilator. But for the most part, 2 nurses staff that unit 24/7. And like I said, it's a 6-bed ICU. The ICU rooms it's hard to describe, but I'll describe them as very large, very modern, beautiful beautiful rooms that are very nurse friendly, and the ICU is just a great place to work for those that are feeling called to that kind of work. Now, the ICU requires ACLS, of course, BLS CPR certification, and ACLS is required within 6 months of the hire. Experience in the ICU is preferred. And I've mentioned NRP, I've mentioned ACLS, CPR, and PAL, the Pediatric Advanced Life Support. Once hired here, all of our nurses and employees who are required to have those certifications, that's provided free of charge by the hospital, by the health system, for our nursing staff and those who are required to have those certifications. It's we utilize the RQI with American Heart, and so all of it is CBL or computer-based learning, and that's provided by the hospital. There's no cost to the employee for those certs.
Okay, and thanks for that, Kevin and Anna Lee, for walking us through those positions. Okay, so for somebody that's on with us today, they want to apply, what next? What should they do next?
So we actually have a website that's listed at the bottom, adamshospital.org/careers, that you can go onto. If you have any questions about anything, I do have my phone number listed as well as my email on that slide right there. I can get you in the right direction or answer any questions that I know. And yeah, we'll go from there.
Excellent. Well, that was Kevin and Anna Lee from Adams Health Network. Thanks again for coming. And with that, we are going to move on, and I'm going to bring Rick back in. Thanks, you guys. And I'm going to bring Rick back in to introduce and talk with Cameron Memorial.
All right, so next up is Cameron Memorial Community Hospital, represented by Seth Berry. Seth, you want to tell us a little bit about Cameron?
Good afternoon, everyone. Thank you. Looks like my name is Sharon Berry, but I've been called worse. Cameron Memorial Hospital, we're located in Angola, Indiana, which is in the very northeast county of Indiana. We're a 25-bed critical access hospital. And the picture you see there, this hospital was, while Cameron's been here for a long time, this facility is actually brand new. It was built just about 5 years ago. And we serve patients, in Northeast Indiana, also Southern Michigan and Northwestern Ohio come to our facility for care. We do offer, we also have clinics. We have an assisted living center. We have an orthopedic surgeon, so we do full, orthopedics here as well, and emergency room, med surge, OB. We really have a great community here. With Northeast Indiana, we have Pokagon State Park. So for any of you that are not from the area, but maybe have come up to Pokagon, that's where we're located. And obviously this is, kind of a tourist destination, as we affectionately call Lakers around here. A lot of people, we have a lot of lakes up here. So it's a very fun community to be in, but, and this is where Cameron's located. But that's a little bit about Cameron. Check out our website and you can get some more information on what we're all about. But I guess we can go right to
let's go right into the first
positions.
Yeah.
I put 5 positions up here, as probably all the hospitals that are going to present today. Obviously, RNs are definitely needed everywhere. We do have a need in surgery, our med surge and OB department. Our med surge is a little bit different than most because we do have an advanced care portion of med surge. So we actually have quite a different variety on our med surge of capabilities. So if you're a nurse that is just wanting to, learn more but are not experienced, in our med surge you can actually learn quite a bit because of the multitude of things that we do. Surgery, we do a full surgery suite. We have a general surgeon, OB, orthopedics. So it's kind of for a small critical access hospital to be doing orthopedics is not completely unique, but definitely a good portion of not critical access hospitals that do this. Unit secretaries in our emergency room. We have a great emergency room that serves this community. I know Parkview, who's on the call, is our tertiary care center. So we partner with them and, for higher level acuity things that we send down to them. But we can handle quite a plethora of services there. And that unit secretary is on all shifts. Same thing with the RNs. Environmental services, so somebody that, we do have opportunities that are non-clinical, that if you're looking to just get into the hospital business, we have definite opportunities. And we've had people from our environmental services that have gone on to other positions in the hospital, from going from a, manual type position to a clerical position or even clinical position. I've been in a lot of hospitals in my career, and I have to say, bragging on us, it's probably one of the cleanest hospitals I've ever been in. But they do a great job, and it's a great team. Patient registration, we are looking for some registrars. Our registration does a little bit more than everybody else. When you're a small critical access hospital, you end up wearing a lot of hats. We're not segregated into multiple tasks. We take the task and put them on one person. In our registration, they do a lot of insurance stuff, and they're highly qualified and highly trained, and spend a lot of time training them. We have those on all shifts as well, first, second, and third shift. And then we also have a patient care tech on our med surg floor helping. While it's not, and you don't need to be certified to be patient care tech with us, you can be. We do hire CMAs, RMAs, LPNs, and thinking of the other one, those types of positions that we will hire into that. The nice thing about the patient care tech is we've promoted multiple people out of the patient care tech role that have gone on to become nurses, and a few of our staff that have become nurse practitioners, through our nurse practitioner program or tuition assistance program, that we have had people go through school. We have actually about 4 of our patient care techs right now that are in nursing school, and that we typically, when they are done with nursing school, they get hired on immediately and with us as a nurse, and get that instant pay raise, which is pretty cool to watch when that happens. The nice thing about Cameron is, we're big enough where we can do a lot of stuff, but small enough that everybody's name, and including our CEO, who's always kind of roaming the halls, and hey Sally, hey Bob, how's it going today? I mean, that's kind of environment that we're in. But good luck to everybody out there looking for a position.
Very good, Seth. And again, if people want to apply, how do they go about applying for any of these positions?
The best thing to do is go to CameronMCH.com/careers. Amy Heine, who is one of our HR business partners, she handles a lot of the recruitment stuff. That's her direct contact information down there, that's, if you get any of those numbers, anybody will be glad to help you. All of our positions are posted online. You can apply online and learn more about us. But if you have any questions, just reach out to us and be glad to answer them.
Thank you, Seth. And so that was Cameron Memorial Community Hospital in Angola. And you have the information there on the screen on how you can apply for any of those positions. Bob?
Okay, thanks, Rick. And next up is Indiana University Health, IU Health, and joining us is Shelley Brannon and Brian Pace. Thanks for you two for joining us today. And I know you're going to be talking about multiple locations, and let's start with kind of a high-level overview of IU Health. Shelley, make sure you're unmuted. Double check that.
Oh, can you hear me now?
Yep, there you go.
Oh, okay. All right.
Jump right in. Shelley, we want to call timeout again. I think you've muted again.
That is so bizarre. I am so sorry.
Yeah, well, that's okay. We can.
Computer and my phone unmuted, so I hope I don't have any feedback going on.
We'll let you know. Sounds good.
Okay. Well, so for IU Health, when you are joining IU Health, why IU Health is because we are one of the most comprehensive healthcare systems in the state. We have 16 hospitals statewide. When you join IU Health, you're joining brilliant minds. We are ranked one of the nation's, among the nation's best by U.S. Report, or by U.S. News and World Report. We also partner with IU Health School of Medicine, which is the largest school of medicine in the nation. So there's lots of opportunities, excellent training for our team members. We do also provide career paths for those. To any team members that comes into the system, as far as non-clinical, clinical, any of those positions that clerical, whatever it is, the leaders love to provide that career path to lead into other positions to give them that promotion that they're wanting to do. So as far as our positions that we're recruiting for today, we have lots of different, if you want to flip the slides, we do have lots of different opportunities, but we are going to focus on just 4 areas, and that's going to be our environmental services, our food service workers, patient transporters, and our medical assistants. For our housekeeper positions, we do, they are part of our front line to infection control. They are part of that infection prevention team. And so they're vital team members to our whole entire system to keep us safe, to keep our patients safe, our family members safe, and our team members safe. There is a lot of cleaning, sanitizing various areas within the hospitals and our ancillary areas outside the hospital walls. But it also includes cleaning those patient rooms while the patients are in them and after they leave. No experience is needed for the patient or for the environmental services. We do on-the-job training, but we do require that you pass a drug screen and a background check. And then a high school diploma is preferred, or GED. However, we do not require that as well. A shift that we have available, we do have days, evening, and nights for housekeeping positions. And then the areas that we're recruiting for today is for East Central Region, and that's for IU Health Blackbird Hospital in Hartford City, and then IU Health Ball Memorial Hospital in Muncie. And then our next position is food service worker positions in our food and nutrition services. Those are the areas that they have many different roles, and they do prepare food, plates. They serve our patients, they serve our visitors, our team members. But they're also responsible for cleaning, making sure they keep the areas clean and sanitized to ensure that food safety for everyone. We also have cook positions. It does say temporary positions, but there are definitely opportunities to become a permanent cook for us as well. But they are definitely under the direction of our chef, and they prepare various diet requirements for our patients' needs, plus prepare foods for our cafeteria. For the cook position, we do require 1 to 3 years of experience, and then we do prefer that food serve safe certification. And that's not required, but we do like folks have that information. Available shifts are mostly evenings, days and evenings. We do not do much on the night shift on that area. But then the opportunities that we're promoting today is for Blackbird Hospital and Ball Memorial Hospital in Hartford City and Muncie. And then the last position that I'm going to talk about, and then I'm going to turn it over to Brian, is our patient transporter positions. The patient transporter positions are exactly what it says. Is that they are the ones that are involved with our patients throughout their day, transporting them to different testings, whether it be an x-ray or physical therapy, wherever they may need to go, as well as discharging them from the hospital. So they're just pretty involved with our patient patient care. The skills needed for that, there is no experience required but you are required to lift up to 50 pounds while you're pushing and pulling and bending and stooping and all of that. So keep that in mind if you're interested in a patient transporter position. Lots of walking throughout. Our patient transporters love to wear the Fitbit to see how many steps they get in each day, because they do a lot of walking throughout their time. As far as shifts available, mostly days and evenings for that as well. We do not do that much during the night shift. The area that we're looking for a patient transporter is at IU Health Memorial Hospital in Muncie. So Brian, I'll turn it to you.
Thank you, Shelley. So again, my name is Brian. I recruit for our medical assistants statewide. We do have a medical assistant tier, so we do have medical assistant 1s, 2, and 3. For the requirements for our medical assistant 1 is a high school diploma or GED, really to get your foot in the door. And then if you get your CMA or RMA certification, that's when you can move up to a medical assistant 2 or a medical assistant 3. The openings we're looking for right now, we have 5 openings at Ball Hospital in Muncie. We have another 4 openings in Fort Wayne and 1 in Anderson as well. All of those are full-time, part-time, or supplemental day positions. But it's a really great opportunity to get your foot in the door if you're looking for medical experience or to get your foot in healthcare. And we have a wider range of openings in our cardiology department, as well as our residency clinic.
Hey, Brian, I got a question that came in for you, and I think you answered it, but if you could just spend a second. The question was, are you guys going to open a hospital in Fort Wayne? So what can you tell us about that hospital and where it's located?
Yep, so that has been in the works for a little bit now. We have some clinics right now. We have staffing that we are bumping up. So the plan is to have one there. And I know our design and construction team spends a lot of time up there, so more information to come.
Okay, great. And so next steps, I'm interested. What do I do? What's the best way to apply?
Yep, so the best way to apply is online. We have a mobile application system that we've spent a lot of time and effort on. We've reduced the amount of questions and kind of the haggle of applying. So it's a really easy process if you want to do it on your phone or computer. We have a bunch of recruiters that we split up between departments and jobs. So we will get you to the right person who can answer your questions, but go to our careers page and we'll help you out.
Okay, and I think we got a shot here on the mobile app, I believe, right? So
yeah, so last year we revamped that. Like I said, we got rid of a lot of the questions that make it really easy to apply just on your phone.
Okay, so Shelley and Brian, thanks for that. And before I send it back to Rick, I'm just going to do a reminder on questions. Do send us your questions. We may or may not get to all of those today, but send them your way. And those that come in for a specific hospital, they'll be back in touch. And today's program is being recorded. So if you think you might miss something, you will be getting a copy of the recording. So with that, I'm going to send it back to Rick.
Thank you.
Thanks so much.
Okay, so now we have MARION General Hospital down in Grant County. I believe it's represented by Christy Beck. Christy, you want to tell us a little bit about MARION General?
Sure. Good morning. MARION General is located in Grant County, as you said. That's about an hour south of Fort Wayne. We are an independent, non-for-profit hospital, 99-bed hospital. We're super proud over the last year. We were designated a top 20 rural community hospital, as well as we've continued to be a magnet hospital for a number of years. We have, just like the other hospital services you would expect, critical care, emergency department, telemetry, med-surg, OB, as well as we have 17 outlying offices with primary care and specialists, and 4 diagnostic centers, so to do our outpatient lab and radiology.
Wonderful. So let's dive into the jobs. Tell us about some of the openings that you have.
Sure. We have a list of several openings here, and we'll just talk about a handful of them. But the list through here, staff registered nurses, our emergency services techs for our ER, patient care techs for all of our units, unit secretaries and sitters. And then in our physician offices, we are hiring LPNs. We do have inpatient and outpatient surgeries, so we are looking for certified surgical techs. All hospitals these days have to be supported by an IT department, so we are looking for network technicians as well. Laboratory scientists, we have a couple positions, and then again in our physician offices, we also have some medical assistant positions open.
And are there any of those positions that where the need is particularly acute, or is it all pretty similar?
It ebbs and flows. Currently, we've been able to attract a good use of a good number of new grad nurses, and so generally that's kind of our area we're really looking. So we're excited to have a big group joining us. Under that, I would probably say our emergency services tech, kind of an extra set of hands with our ER patients. So we'll talk about that position in just a moment.
Okay.
Perfect. So our first position, as we touched on, is our staff RNs. We currently have openings in our emergency department, our family birthing center, which is where our OB patients are, our operating room. We have an acute rehab hospital within our walls, and our telemetry unit. We do have days, evenings, and night shifts available. With our evening and night shifts, we do offer a fairly generous sign-on bonus as well. And like I said, we have some full-time and some PRN positions. With our RN positions, we are happy to take on new grads, help them find their way into nursing. We'll actually hire them before they are able to get licensed to put them in a grad tech position so they can start their training and education with our RN training team.
Great. And next?
Sure. Next we have up, and for benefits, I'll just touch on that for all of our department. We have benefit elections including health insurance, dental, vision, life insurance, disability. We do offer shift and weekend differentials for our night and weekend shifts. We are a non-for-profit, so we have a 403B retirement savings plan. Staff earn paid time off. We have sick child care, YMCA discounts. And so there's more information kind of on our benefits on our website, and actually employees become eligible for benefits on day one of employment.
Terrific.
And then that second position that we touched on a moment ago is really our Emergency Services Tech 2 position. These are the staff that assist hands-on patient care, assist the nurses and doctors in the ER. We do have a fairly busy emergency department. We're the only hospital in our county. And so these techs are critically important to providing the care that we want our patients to have, as well as assisting our medical professionals. So for qualifications for this, you can kind of qualify in a variety of ways. If you have experience as a medical assistant or a phlebotomist, they do phlebotomy, or if you have completed at least your sophomore year of your nursing clinicals, or if you are a current LPN. And so it's a great opportunity for nursing students to get some hands-on experience in the emergency room if that's the area they think they want to go into. The emergency room is an environment of its own as far as excitement, we'll say. And so it's a great opportunity for students to feel out if that's the right place for them and start gaining those skills.
Good. And I see we have pretty much the same full-time benefits for that.
Yeah, yep, all these positions are the same with the benefits. So, and then the next position we have is a patient care tech position. And this kind of falls in line with some of the CNA positions that other hospitals have talked about. We do have multiple units that are looking for CNAs providing direct care, just again, extra support to our nurses. So we have full-time and PRN postings available. We have some different combinations of this position as far as some of them are also unit secretaries, or on our telemetry unit, they're monitor techs. But the same basic duties as far as providing care to patients while they're in the hospital. The minimum requirements for these is that you would either need to be a CNA, a home health aide, or again, we will accept nursing students. And so if you have completed nursing fundamentals coursework, this may be another option to get on some different units of the hospital, be able to work side by side with the nurses, hone your skills, as well as maybe decide what sort of nursing will be a good fit for you.
Great. And so, oh, there we go. The unit secretary job.
Sure. This is one of the positions that can be a good entry-level position for someone interested in healthcare, maybe has a little bit experience in some capacity, maybe not. The unit secretary sitter will help with kind of some of the unit secretary duties. They'll occasionally assist with, providing patients water or small tasks, as well as they may be a sitter for patients that need some extra support while they're on our units. A high school diploma is required. There is a preference that there's at least some medical terminology course or you're working in the medical field, but that is not required. If you're someone that's just passionate about getting into hospital work environment or just love, assisting patients, this may be a good option to get in the door.
And then we have one more.
Sure. Our last position on here is for our LPNs and our physician offices. As I said, we have 15 different medical offices all in Grant County. Most of them are primary care, but we do have a large OBGYN office. We have pediatrics. We have a surgeon's office. And so we're looking for LPNs that can come in, help taking care of those patients, help taking care of the paperwork that's required to provide medical care, and assist the doctors and nurse practitioners in providing care. Those LPNs just need to be licensed as LPNs and completed an LPN program.
Terrific. And if people want to apply for any of these positions, how do they go about doing that?
Sure. We encourage anyone to get on our website. There we'll have all of our positions listed by the names that I provided, or if there's other positions that would interest you, and you can actually apply then directly from the website by clicking on those postings.
Well, thank you very much, Christy. That's MARION General Hospital down in Grant County. A lot of really good positions there, both for people who want to enter into healthcare and those who maybe have a little bit more experience.
All right, thank you.
Bob, yeah, thank you. Bob?
Okay, thanks, Christy and Rick. And the last of our 5 health systems is PARKVIEw Health, and joining us is Jenna Steer. Jenna is the talent acquisition consultant. Jenna, good morning, and why don't you give us a little overview of PARKVIEw?
Sure. So PARKView is based out of Fort Wayne, but we have, of course, expanded beyond that. We are a non-for-profit, community-based health system. We are actually the region's largest employer with now over 13,000 employees. Our network consists of 10 hospitals now and over 100 PPG offices, which would be our primary care offices, as well as some specialty care offices as well. So we have 2 hospitals here in Fort Wayne, and then we have all of our community hospitals in areas like Whitley, Warsaw, Wabash, LaGrange, Huntington, Noble, and then recently we acquired DeKalb in fall of 2019 as well. So we have a hospital there. We are actually continuing to expand. What is the PARKView Warsaw Complex will be a full-fledged hospital coming in 2022. Currently they just see inpatient, but they're going to be expanding to outpatient facility, or reverse that. They currently have outpatient facilities, but they're going to be transitioning to a full hospital offering inpatient as well. And then we have some more growth going in our other hospitals still as well. So we'll talk a little bit about some of the positions that we have in all of our areas.
Okay, you're going to talk about 5 of them, right? And 5 positions, and I think the first one you're going to kind of walk us through the nursing area and what you're looking for, right?
Yep, absolutely. So with PARKView being such a large organization, we do have a lot of needs throughout our system. But right now we do have, of course, a big need for nurses, and some of our biggest needs come in the areas where we are growing. So at our Parkview Regional Medical Center campus here in Fort Wayne, we are opening a second tower, so we do have a pretty big need there. That tower is going to be planned opening for this fall in September. So we have some units like our ASU unit, our Medical 6 and Med 7 units are going to be looking for RNs. We would have some 24-hour per week and 36-hour per week positions open there for day shift and evening shift. And we are going to be offering actually a $10,000 sign-on bonus for those areas where we're expanding there right now. And then we also have some growth happening at our Parkview Rangelia campus on one of our med-surg floors as well. We have some part-time day shift and night shift, as well as a full-time night shift position. And that area is also offering a $10,000 sign-on bonus. And some of our other areas where we do also see a need for nurses right now are in the NICU at our Parkview Regional Medical Center here in Fort Wayne, as well as our community areas. We have some night shift positions that we're looking for at Parkview Whitley, Huntington, as well as Wabash in a variety of different areas. And with our nurses, we do offer a lot of growth opportunities there. So even just starting with onboarding, they have what we call a jumpstart program that we go through. So as part of your onboarding process, you go through that, and it's doing onboarding and training in realistic simulation labs. And then as you continue to grow from there, we have things for new grads, like the nurse residency program and a step-up program, which can allow for more growth there. And then I'm actually going to jump down to our case management specialist position. We do have some openings there. They are at our Parkview Regional Medical Center and also Parkview Rangelia, so both here in Fort Wayne. We have a part-time position available at PRMC, and we also have a full-time position available at PRMC and Rangelia. And all of those are going to be full-time day shift positions, and they offer up to a $2,000 sign-on bonus for those positions. They do still require an RN license, but it's going to be a non-bedside nursing position. So another area that we see a lot of need in right now is our patient care area. Specifically within the patient care tech positions. Those do require either an active CNA license or an active nursing student could also qualify for those positions. And some of our big needs, again, are in the areas where we are growing, like that med-surg unit at Parkview Rangelia. We do have some part-time night shift positions there, as well as a few day shift, but primarily night shift positions there. And then those new units at our Parkview Regional Medical Center, again, the ASU unit and some of our other med-surg units as well are going to be looking for some PCT positions. And then we also have a pretty decent need in some of our community hospitals as well, like DeKalb, for example. Their med-surg and ER areas are looking for some pretty substantial PCT positions there as well. And we also have some surge tech positions, and they're going to be helping in operating rooms. They're going to help prep the room for the procedures and also assist the surgeons throughout the procedure. We have some full-time, part-time, and PRN positions available at our Parkview Regional Medical Center. And those do also qualify for a sign-on bonus of up to $5,000 there. And then we have some phlebotomy positions, which they're also going to be our lab support. So they're going to be helping with those processing needs within the lab. And right now we do have some part-time night shift positions open at our Parkview Regional Medical Center, as well as a part-time position open night shift at Parkview Rangelia for our lab.
Hey, Jenna, I got a question that came in. I don't want to interrupt you, but we can move on in just a second. But there was a question that came in. It said, can you apply for a couple RN positions at the same time to see what different areas offer?
Absolutely. We have Part of our talent acquisition team is actually dedicated to just nursing, and they all work very closely together. And it's definitely common for someone to apply to multiple RN positions and kind of explore different areas. We honestly kind of encourage that and expect that. That way you're finding the area that really best fits you. So absolutely, you can certainly apply to more than one area.
Okay. And the EMT?
Mm-hmm. Yep, so our EMT positions, so they're going to be doing the patient care for those coming in on ambulances into the hospitals. So really they're that first piece in that patient care process for the patients that are coming in that way. And right now we do have openings in several of our community hospitals like Huntington, Wabash, Whitley, DeKalb, and Noble. But we do also have some positions open here in Fort Wayne. But those positions are going to be full-time, evenings, nights, and day shifts are available. And we do have one part-time evening shift position that's open at PARKVIEW DeKalb as well. So I definitely recommend checking out our website to see more info on what the schedules are like for those positions there. So PARKVIEW, of course, does have some pharmacy positions available as well. We have, of course, a kind of an increase in volume in that area right now. So we are looking for some farm tech positions. The biggest need is at our PARKVIEW Regional Medical Center here in Fort Wayne right now. But those positions are available in full-time, part-time, and PRN, which would be our as-needed schedules there. Primarily day shift. We do have a couple of part-time evening shift positions available there as well. But then we also have 2 positions available at our PARKVIEW Whitley Hospital as well. Those are also part-time. They are going to be day shift, so the hours would be 7 to 5:30 for those openings there. They do, of course, require an active farm tech license or having a license that you are a farm tech in training, and also having completed and received your high school diploma and GED, as well as being enrolled or having completed a training program as well. So the last position that we'll kind of touch base on is the medical assistant position. So these positions will work within mostly our physicians' offices, our PPG offices. They are going to be kind of scattered throughout the area here as far as what offices we have open right now. But we do have some full-time, part-time, and PRN positions available throughout Fort Wayne within all of our different PPG offices. Some of them are primary care offices and some are specialty offices there. And then we also have medical assistants that work in our walk-in clinics. So our walk-in clinics are going to be in areas like Auburn, so around the PARKVIEW DeKalb area, as well as the Fort Wayne St. Joe Center office has an opening. Huntington, New Haven, and Wabash walk-in clinics also have openings for MAs as well. And those MA positions do also have the ability to qualify for a sign-on bonus up to $2,000. So definitely check out what those schedules are and where they're located as well.
Okay, next we're going to talk briefly about benefits.
Sure, absolutely. So PARKVIEW offers quite a substantial benefit package. So we have our healthcare option, which would cover your medical, dental, and vision. We do offer that to all of our 0.6 FTEs or higher, so it's 24 hours a week or more, you would qualify for benefits. And our benefits do go into effect the first of the month following your start date. And we also offer paid time off to our positions that are, again, 24 hours per week or more. And then PARKVIEW actually covers the short-term, long-term, and disability options, as well as the basic life insurance. And the 403B plan, we also offer that. And since we are a nonprofit, it's a 403B, but again, it's the same thing as a 401k. And we have a lot of different voluntary benefits that we offer as well. So we offer things like supplemental life insurance, so you can enroll in additional coverage and on top of the basic coverage that we already offer. We offer things like critical illness insurance, accident insurance, and we even offer a pet insurance option. So there's lots of different opportunities there for coverage. And then we do have a really great tuition assistance program that we offer as well. So depending upon your degree track, you could qualify for up to either $2,000 or up to $4,000 a year there in tuition assistance. And that is something that we offer to Parkview coworkers who have been here for 6 months or more. And then we have something that we've also implemented that's called a student loan payback program. So for those that have already completed their training or their degree programs and they have that student loan that they need to pay back, certain degree tracks do qualify to actually have Parkview help with paying that debt back. So that would be up to a total of $30,000 in sum in total. So that again is offered for certain areas. So areas like an RN or a surge tech or certain lab scientist positions, we do offer that loan payback program as well.
Okay, so if I'm interested, what do I need to do to apply?
Sure. So first thing, I would definitely recommend checking out our website. All of our openings are listed there. And then if you have questions on positions, you can either go ahead and apply online or you can also send an email to our talent acquisition team, which is going to be that jobs@parkview.com. You can attach a resume, let us know what areas you're interested in, and then we can get you in touch with the consultant that's over those areas. Or I think probably the quickest way for you to get in touch with someone on our talent acquisition team is to actually text that 97211 number. That is our text supply option. So that gets you in the inbox to talk with someone from our team pretty much right away. Somebody's always monitoring that inbox. So even if you are interested in positions that we didn't talk about, like our non-clinical areas like registration or housekeeping, definitely still text that number and let us know kind of what you're looking for, and we can still talk with you about what opportunities are available. So definitely reach out in any of those options, and we're all ready to have some conversations with you guys.
Okay, so Jenna, I did get a couple questions come in here. One asked if you could speak very briefly on the student nurse apprenticeship program in Fort Wayne.
Sure. So that is something that we offer to current nursing students. So you can start working in that position as you're going throughout your degree track. Start getting some hands-on experience there, and then once you've, of course, completed that program and you've graduated, you could then move into an RN position that we have available. So it's definitely a great way to get your foot in the door and start getting that hands-on experience here with Parkview, and then you can continue to learn and grow with Parkview as you proceed and go throughout your career.
Okay, and then the last question for right now, the pharmacy tech. Do you know what the sign-on bonus is for that?
Sure. So I actually don't know offhand that position qualifies for a sign-on bonus. But if you did have any other questions about that, definitely reach out to us. But I don't believe that position qualifies for a sign-on bonus.
Okay. And again, we're getting lots of specific questions coming in, all good stuff. But what we'll do is we'll push this back to the individual health systems to follow up. I got questions for everyone on X-ray positions, recent pharmacist graduates, higher education attainment, those kind of things. So what I'm going to do next is I'm going to run up and down the line real quickly if hopefully everyone's still there. And one of the questions I got for most of you is previously applied. So I previously applied at your place. Do I start over, or what happens with that? And I'm going to jump back to the Adams Health folks, Anna Lee and Kevin, if you're still on, if you can answer that, if somebody's already applied, and then anything else that you might have thought of over the past hour that you want to add.
Yeah, so we are still here. If you have applied in the past and you haven't heard anything from us, we ask you just to reapply or even just message me. We did get a new application website, so your application in the past year could have been lost. So yeah, just give us a call or even just reapply and we'll get to you.
Okay, and that was Adams Health. Anything else you want to add, Annalee?
I think that's good. We also have housekeeping, food service workers, cook position as well. Those entry level positions that we are looking for to get your foot in the door in the healthcare field.
Okay, and I know that you just highlighted, all of you just highlighted certain positions, and so I think for all of you, go to the website, and there you'll find many, many more positions that several of you asked about. So I shouldn't say Sharon. Seth Berry at Cameron Memorial. Seth, if they've already applied at your place, same answer, and then anything else you want to add? I wonder if Seth's still with us. Maybe not. Let's see if Shelly and Brian, are you still with us? IU Health?
Yes, sir. So yes, so if you have not heard anything, I would encourage you to reapply. We do need an active application within the last 6 months to be considered.
Okay, great. Anything else you guys want to add?
I don't think so. I guess I do want to say if you have applied, it's very easy to apply for any other positions because there's a copy feature, so you don't have to go through that long application. You can actually copy that and just kind of edit as needed. So it makes it a little bit easier.
Okay, and thanks, Shelly. And Christy Beck at Marion General, if I've applied before, same answer, reapply?
Yes, absolutely. Apply again. If you remember your account information to log in, you can log back in and use the same application. I encourage people to check it once in a while, see if things have changed. Maybe you notice some errors. But if you don't remember your login, you can also go in and create a new account and then just reapply for any positions that interest you.
Okay, thanks for that. And anything else, Christy?
Nope, that'll do it. Thank you.
Okay, and last, Jenna Steer. Jenna, previously applied. Anything else you want to throw in?
Yeah, since we do have, such a high volume of applications that come in, we definitely recommend you to keep applying. So if you've already applied, definitely reapply. But if you even want to reach out to us through that text number, so again, just text Parkview to 97211 and even just let us know that you have applied and what areas you applied to or what you're interested in. That would definitely be a great way to ensure that you can get in touch with someone as well.
Okay, so with that, we are going to wind the program down, and I'm going to, just a real quick reminder, I got several things that have come in asking if we can show the website addresses again, but you are going to be getting a copy. So the recording tomorrow at this time, you can go back and review all the information, including their websites. And before I throw it back to Rick to close, a couple things I want to add to finish with. We have some things that came in on the pandemic unemployment assistance program. These are for some people that are now working in healthcare that may be unemployed and not have any income coming in, self-employed contractors. And the good news is that program, which is set at $600 a week, is actually going to start taking applications this Friday. So Friday the 24th, you'll be able to go online at unemployment.in.gov and apply as an independent contractor, a self-employed person that's in healthcare. So wanted to pass that along. Several of you asked. And before I leave, I do want to thank Rick and Kim for all they've done. This has been a tremendous program, the biggest one we've had yet. And I would be remiss if I didn't recognize Kathleen Randolph and Edmund O'Neill up in Region 3 for the great job they do leading, again, that region. Tremendous. They're doing a tremendous time right now and throughout the year. So with that, I'm going to turn it over to close things. Rick Ferrett and Kim Temple.
Okay, thank you very much. I'll make it pretty quick. I want to thank all the healthcare providers, obviously, especially for taking time out. Extraordinarily busy time for all of you, but a very important industry, not only for the care that you provide for people, but it's our second largest employing industry. I too want to hand out a few thank yous. I want to thank DWD for the work that you've done to arrange this job fair, especially in the midst of all the other tasks that you need to complete right now. And so hats off to you, Bob, and to Dave Shatowski and to Kylie Schroeder. You've just been really wonderful partners. I also know that Kim Temple has just a few really quick concluding remarks. I want to get her in here because she really is the driving force for our organization in employer engagement. So Kim?
Thanks, Rick. I just want to say very quickly, just to thank you again to our employer partners for your involvement and the participation in today's event. Our business services team stands ready to support Northeast Indiana employers with their recruitment activities, pre-screening assessments, and other workforce needs. So please don't hesitate to reach out to your business service representative, myself, or your local Work One Northeast Career Center to discuss how we can continue to support you and your organization. I see there on the slide is the Northeast Indiana Works website address, so feel free to reach out to that website if you don't know the contact information for your local Work One Northeast Career Center. Again, thank you all for your participation and hope you all have a safe day.